Good afternoon, thanks for joining us. I'll give you today's statistics first of all as usual. There were 880 positive cases reported yesterday, which is 6.8% of the total number of tests that were carried out. That means the total number of confirmed cases so far throughout the entire pandemic is 90,961. 260 of the new cases were in Greater Glasgow and Clyde, 190 in Lanarkshire, 122 in Grampian and 94 in Lothian. The remaining cases were across 8 other health board areas. 1,161 people are currently in hospital. That is 36 fewer than yesterday. 84 people are in intensive care. That's the same as yesterday. And finally, I regret to report that 44 additional deaths have been registered in the past 24 hours of patients who first tested positive in the previous 28-day period. The total number of deaths under this measurement that we use on a daily basis is now 3,588. However, National Records of Scotland, as it does every Wednesday, has just published its weekly update that, you will recall, includes cases where COVID is a suspected or contributory cause of death, in addition to those that we report daily where COVID has been confirmed through a test. Today's update shows that by Sunday just past, the total number of registered deaths linked to COVID under that wider definition was 5,380. 244 of those deaths were registered over the course of the last week. That is actually 35 fewer than in the week before. And that is the first decrease in the weekly number of deaths that we have seen since the end of September. Any reduction in the number of people dying is, of course, good news, but any feeling of relief that we feel about that must be tempered by a recognition that the number of deaths is still far too high. 160 of last week's deaths occurred in hospitals, 67, my apologies, occurred in care homes, and 17 at home or in another non-institutional setting. Now, every single one of those deaths was of an individual who will be right now mourned by friends and family. So again today, as it's important to do every day, I want to convey my condolences to everyone who has lost a loved one as a result of this virus. Now, I have a couple of issues I want to cover today before I, with Professor Leitch, will take questions from the media. The first is that literally as we will be speaking here today, the Chancellor of the Exchequer will, in the House of Commons, be delivering his autumn statement. Over the course of this pandemic, the Scottish Government and the UK Government have worked together constructively on many issues, and I'll come on to talk about arrangements for the Christmas period in a moment, and that is one of those issues. But we've also welcomed several of the Chancellor's recent decisions, for example, the extension of the job retention scheme until the spring. But we do believe that there are several areas where families and businesses are likely, as a result of the pandemic, to continue to need help even after April of next year. And that is when many of the current support mechanisms are scheduled to end. Now, the kind of areas I'm talking about would include rates relief for businesses and the uplift to universal credit for households and individuals. So we're very much hoping that today's statement brings clarity and positive news on these issues. That would be very important in providing certainty as all of us continue to cope with the immediate impact of COVID. And of course, it would provide the Scottish Government with greater clarity as we prepare our own budget, which will be presented to the Scottish Parliament in January. And that budget will provide more details of the support we are able to provide for businesses and individuals into the next financial year. So the more clarity we have from the Chancellor about the overall spending envelope would be very welcome. Now, the second issue I want to cover, and perhaps just take a few moments to dwell on today, is yesterday's announcement about arrangements for the forthcoming festive period. Let me tell you that the Scottish Government will be publishing more detailed guidance, fleshing out what we said yesterday. We'll do that later this week, hopefully tomorrow, and I will set out some further details in Parliament ahead of the weekly session of First Minister's questions. However, as you will undoubtedly have heard yesterday, the 4 UK nations decided that for a 5-day window over Christmas, that means from the 23rd of December to the 27th of December, inclusive, we will relax slightly the current rules on travel and household meetings. This relaxation will enable you, if you feel it's necessary, and that's a point I want to stress, and I'll come back to that point shortly. You feel it's necessary, the relaxation will enable you to form a bubble of up to 3 households over that 5-day period. Now, let me stress, if you choose to do that, it has to be just one bubble. You can't chop and change it over the 5-day period, and none of the households in a bubble can form another bubble with other households. Now, as is the case with most of these COVID decisions, some of you will think this is a reasonable decision that we've arrived at. Others of you will think it doesn't go far enough. And many of you will think it's a terrible decision and it goes way too far. And my email inbox has all of these views expressed within it today. But I think that just reflects a reality that none of what we are dealing with right now, none of what we are seeking to steer and navigate our way through is straightforward. And speaking as First Minister, as head of the Scottish Government, we agonise over all of these decisions. And often we are trying to balance all sorts of different factors and come to not a perfect outcome, because in a pandemic, I'm not sure there is such a thing, but come to the outcome that balances best all of these competing factors and desires that people have. And on this particular occasion, what we are trying to do is reflect a reality that for some people, whether I like it or not, sticking rigidly to the current rules over Christmas, if that means, for example, leaving loved ones on their own, is something that some people might not be prepared to do. So rather than just leave everyone to try to navigate that themselves and decide their own boundaries, we came to a decision to try to set out some outer limits and some boundaries that we're asking people to work within. But, and this is the key point, notwithstanding that decision, which is trying to recognise a reality that I've just set out, that does not mean that we are positively encouraging people to get together. I want to stress today that just because we are allowing people to create a bubble, it does not mean that you have to do it. And if you do choose to do it at all, you don't have to do it to the maximum permitted. We are relying on people, as we have been throughout this entire pandemic, but maybe particularly over these next few weeks, we're relying on people across the country to make informed choices about whether or not to come together at all over the Christmas period. We recognise that for many people, supporting others and their families by being with them will be something that they feel is essential. But for others, it won't be essential. And you might choose this year, therefore, to mark Christmas very differently to how you normally would. Because the virus will not have gone away by Christmas, and it's really important that I am very straight with you about that. And we know bringing people together at home carries risks. That's why we ask people not to meet in each other's homes right now. And of course, after 8 months of very hard and very painful sacrifice, of keeping loved ones as safe as possible, and now that we are so close to a possible vaccine, we all have to ask ourselves if that is a risk we personally want to take. So, as I say, we will produce guidance to help you come to these decisions and to minimise risks for those of you who do choose to come together, albeit in a limited way, over the Christmas period. As I said a moment ago, we'll set out more detail of this guidance tomorrow, but let me repeat now some key points which you will no doubt hear me reiterate over the weeks between now and Christmas. And the first point is this: if you can get through this Christmas staying in your own home, within your own household, please do so. That would be the safest decision, and that, I guess, is the default advice that I am giving to people. However, if you feel you need to see somebody from another household, please limit that as much as possible. Remember what I said about the 5 days, 3 households. That is outer limits. That should be seen as a maximum. Stay as far within that as you possibly can. And if you feel it is essential to see others, think about how you do that and think about whether you could do that differently to how most of us traditionally celebrate Christmas, particularly Christmas Day. So for example, and I know this is something I'm thinking about in my own personal circumstances, instead of meeting indoors for Christmas, go for a family walk together, exchange presents on the way, see each other outside. All of this sounds difficult and strange, but we are living in difficult and strange times. And of course, if you are indoors with people from other households during this limited window, keep windows open, keep the literal windows open, follow all of the hygiene rules. It will be difficult to remember that, I know, but wash your hands, clean the hard surfaces in the house that you're in, and keep a physical distance as much as you can. That will be the hardest thing of all if you're with loved ones, not hugging them and trying to keep apart. But it is really important that we all remember and don't allow to go by the wayside these really important rules we've all been living by. Now, the fact that I'm stressing all of this, despite the announcement we made yesterday, underlines that yesterday's decision was not an easy one. In fact, it was a really difficult one, I'm sure, for all the governments involved. We know that the festive period means a lot to people. It means a lot to us as well, as individuals. And we know in particular it can be an especially difficult time to be alone or to feel isolated. So because of that, many people, in seeking to do the right thing over Christmas, will come to the view that for them that means spending some time with friends and loved ones. And it's for that reason that we've decided to provide some rules and guidance that will minimise the risks of that. But these rules, if you exercise the flexibility that they give you, still have a risk attached to them. We know that people can be infectious without having symptoms of COVID. So I think all of us find it really hard to fathom and believe and comprehend that it might be our family gathering that is the one that has a risk attached to it, but it may well be. And particularly if you're bringing together people in different generations, that risk to vulnerable people can be great. And that is exacerbated indoors. So all of this is difficult. Governments agonise over these decisions, and I'm sure families will be coming to very difficult decisions as well. We are trying to give a framework in which we can all reach these decisions, but I will continue to ask you to err on the side of caution, to think about the safety of loved ones, and not to forget how close we may now be to an end of this pandemic. And if you've been making painful sacrifices for 8 months to keep those you love safe, then think about whether you want to take a risk with their safety at this 11th hour in this horrible journey that we're all going through. And one final point I want to stress before moving on to questions is this one. While we're all thinking about Christmas, as is inevitably the case as we get towards December, Christmas is still 4 weeks away. And actually, the most important thing we can all do right now to make not just Christmas as safe as possible, but the period after Christmas as safe as possible, is to reduce the number of people that are infectious now. And for all of us, that means sticking to all of the rules and guidance that is in place right now. If you are in doubt about what the rules are in your local area, please use the postcode checker on the Scottish Government website. But remember, you shouldn't be visiting other people's homes just now unless you live in the islands, Orkney, Shetland and the Western Isles. You shouldn't visit people's homes unless it is for an essential purpose. If you're meeting outdoors right now or in an indoor public place where these are open, stick to the limits of 6 people from 2 households. Don't car share if you can avoid it. Work from home if you can. Download the Protect Scotland app. And remember the key rules encapsulated in facts that help to keep us all safe by limiting the risk of the virus transmitting from one of us to another. So remember to wear face coverings, avoid being in crowded places, clean your hands, clean hard surfaces, keep a 2-metre distance from people in other households, and self-isolate and get tested if you have symptoms. These are all difficult things to live by. As we head towards Christmas, all of this will feel even more difficult, and that is saying something than it has done over these past 8 months. But as we go through this tough winter and tough festive period for all of us, let's keep our eyes on that light that is getting brighter almost every day that passes right now, that is there on the horizon. The end is in sight. Let's not forget that as we keep ourselves motivated through the remainder of this pandemic. Thank you very much for joining us and bearing with me today. I'm going to move straight to questions now, and Jason will help me answer them as we go along. Tim Batchell from ITV Border is the first question.
Thank you, First Minister. I wanted to ask you about the Christmas rules. At the moment, travel restrictions are a very important part of your strategy. Obviously, at Christmas, those are going to be relaxed so that people can move around the UK as they want. I spoke to Professor Linda Ball this morning, who said in many ways she's more concerned about travel than household mixing. And I wonder whether you thought that at Christmas, that is the right time to be relaxing these rules.
I trust you've just listened to everything I've said, Tim, and I'll try to kind of summarise my view again. The flexibilities that we announced across the four nations yesterday are a recognition of a reality that exists over the Christmas period, whether I like it or not, which is that some people, I'm not saying the majority, I'm not saying everybody, but some people will simply decide that they can't stick to the very tight restrictions that are in place now because they're not prepared to leave a loved one on their own or not see some family over Christmas. Now, I think that's a reality. Now, as government, we have a choice. Do we simply accept that and let people navigate their own way through that and decide themselves what the boundaries are? Or do we say, OK, we recognise that reality and we're going to try to put some boundaries around that to minimise the risk as much as possible? And we've chosen to do the latter. And that involves the flexibilities in the 5-day window, the 3-household bubble, and the temporary, over that 5-day window, lifting of travel restrictions. But, and this is the but, that does not mean I am standing here advising anybody to take advantage of those flexibilities. And that's what I've tried to set out. My default advice is that if you can get through this Christmas without that, if you can get through by staying within your own household, within your own home, then do that. If you feel you need to see somebody, think about how you limit that and do that as safely as possible. So, you know, maybe just one household and do the family outdoor walk rather than the indoor Christmas dinner. But if you need to go further, these are the boundaries we're setting. And that's not a perfect way to try to get through this. But it is, I think, on balance, better than simply letting everybody decide what their own boundaries are if they feel that they can't stick to the very rigid restrictions that we are in just now. So I will do my level best between now and Christmas to develop and communicate an understanding of risk and give as much guidance to allow people to come to informed decisions. And I will try to do that as best as I can. And we're all having to make these judgments. I stand here every day as First Minister, but I'm also a human being with a family of my own. And, I was in answer to a question the other day talking about not having seen my parents since mid-July, which will be the same as the situation many people are in. And, I am desperate to see my mum and dad, and I would love to think that we could come together as a family at Christmas. But after all these months of sacrifice, I don't want to put my parents, who don't like me calling them elderly, but are getting towards that end of the age spectrum, I don't want to put them at risk for the sake of one day, when if I wait just a few more weeks or 2 or 3 more months, maybe they'll be vaccinated and we can get together in a way that is safer. So these are really difficult decisions. And as I said, whenever I take and the government takes any of these decisions, I recognise some people will think, yeah, that's fair. Other people will think that's the worst decision you could ever have reached. And people will have that view for different reasons. We're trying to steer the best possible course through a horrendously difficult situation right now. And I'll stand here every day and try to communicate that and help people reach these judgments to the best of my ability. Ewan Petrie from STV.
Thank you, First Minister. There seems to be an acceptance that relaxation will result in a rise of cases and could even ultimately cost more lives. Is giving people a choice in how they follow the rules pushing the responsibility for that entirely onto them, and could it risk undermining compliance with measures after Christmas?
No, I don't think it is. And I hope that whether you agree, disagree, or a mixture of the two, which is probably the position most of you are in, agree with the decisions I've taken in the last 8 months. I've not tried to pass responsibility from here, where it belongs, onto anybody else. But I've also recognised that, while I take my responsibility very seriously, I cannot single-handedly protect the country from this virus. I rely on people listening to and abiding with the advice we give. And by and large, I think the majority of people have done that. But that also at times means treating people like grown-ups and recognising that there are particular times, I think Christmas is one of them, where for some people, regardless of what I say, they will want to reach their own judgments for what they see as in the interests of their own family. And I can either just shrug my shoulders and let that happen, or try to help us all collectively manage our way through that as safely as possible. So that's what I'm seeking to do. Every single decision we've taken in the last 8 months can be described in the way you've just described it. You know, this I've talked before about every day, and this is true for governments right across the world. Every day, you know, decision making right now feels as if you stand here with lives in one hand and jobs and family connections in the other hand, and you're trying to balance. Every time we open up a part of the economy, you can make the argument that that's giving the virus opportunities to spread. So theoretically, that is leading to more cases and potentially more people dying. So these are always horrendously difficult decisions, and we continue to try to take them with public safety and minimising the health impact of this and all of the wider impacts of this absolutely at the forefront of our minds. And government, and I speak personally here, we will never shy away, I will never shy away from the central responsibility I have to try to lead people as sensibly as possible through a really difficult situation. Jason, do you want to say a bit more?
So I have almost the same angst as you, First Minister. You can hear it in the First Minister's voice, you'll hopefully hear it in mine. This is such a difficult balance to strike. I have worked Christmases for years as a surgeon before I did this job. And Christmas is the most joyous time of the year for many of us, but it's also quite a lonely time for much of our population, particularly those who live alone, but not entirely them. Lots of people have memories at Christmas of family times or other more difficult times. So to strike a balance here inside a global pandemic is really, really difficult. And there isn't a right answer. There isn't a risk-free route. And this is the best set of risk-free decisions, risk decisions we think we can make. I spoke to my own family last night. They, again, don't want to be called elderly. In fact, I got very strict instructions not to do so. But they will both be vaccinated in the first wave. So that will give you some idea of where they sit here. And we decided that we wouldn't meet as a family over Christmas indoors and have Christmas dinner. And my dad said, I knew that was going to be the answer, but I just didn't want somebody else to say it out loud. And I think that's how lots of families will feel. Now, I might have acted differently if mum and dad weren't in the same house and had each other for company, and we could speak to them digitally, but others will not be able to do that. Others will be alone, they won't have internet connection, and they may well need, for social isolation reasons, to meet in some form. And these guidelines, more tomorrow, will be about keeping that as safe as we possibly can. But months ago, during the first wave, I stood here and I said, the best protection against this virus is your front door. And that remains the case. The best protection against this virus is your front door, even at Christmas. So if you do something with family yesterday or on the 25th of December, that is risk, and you should keep it to an absolute minimum, particularly now when we can see some light at the end of the tunnel.
Glenn Campbell from the BBC.
Hello, First Minister. I am looking for some clarity, if you're able to give it, on the Christmas arrangements, but also on behalf of a colleague. Can you say how seriously you're considering airport testing as a way of monitoring COVID arrivals in the country and potentially cutting quarantine? But on Christmas, you've suggested you yourself might not meet with your parents over the festive period. But for those who do want to take advantage of the flexibility, will an extended household be considered as one or two households for the purposes of Christmas? Should people who are travelling back to the Scottish Islands have an extra couple of travel days as those who are going back to Northern Ireland will have? And should there be extra trains and planes, especially cross-border, to allow people who live in other parts of the UK to get back home?
So the specific questions you've asked me are the ones that we will cover in the guidance tomorrow, and we're just finalising all of that. But what I can say to people today is don't expect the guidance to further expand what was set out yesterday. If anything, the guidance will probably look at how we tighten that so that it doesn't become something we are allowing for the reasons I've talked about into something that is much more expansive. Now, without going into the detail of the Four Nations discussions, one of the reasons I was very keen that we had the definition of household determined nation by nation was partly because we all, for COVID purposes, have a different starting definition of household. But I know, and this is entirely their right to do that. This is not meant genuinely as a criticism. But I think in England, where they already have bubbles of 2 households that can come together in some parts of the country, not right now during lockdown, but more generally, they intend to have a household that is the existing bubble. So 3 households there potentially, depending on how they draw the guidance, could effectively become 6 households. I think that would be going too far, and it wouldn't be something I would be comfortable with in Scotland. Now, we have the extended household concept, which is where one person who lives alone or lives alone with children under 18 can join another household and become an extended household. Now, we are considering whether that will be the definition of household or not, because what we don't want to do is inadvertently allow a 3 household limit to become more than that. So we'll set that out tomorrow, but I would say to people the expectation should be that the guidance will probably look to tighten around the edges rather than further expand, and that will be true of travel, the travel window of opportunity as well. We want to limit that window, not expand it, and public transport will, for important and vital reasons right now, continue to have capacity constraints over Christmas as it does right now, because physical distancing, for example, and therefore we need to encourage people to plan ahead if they have to travel. Remember, we are not advising or encouraging people to travel, but if you have to do that, to plan ahead and not assume that there's going to be masses more capacity there to do that. This is about giving some important, necessary, and given the circumstances, perhaps inevitable leeway. It is not, and the Scottish Government will be very careful here not to turn this into some kind of licence for us all to forget the difficulty that we are facing and the risks that COVID presents. So we will set this out in guidance, but what was announced yesterday should be seen very much as outer limits, not a starting point that will bit by bit be extended. And I think that's just an important bit of clarity for me to give at this stage. On airport testing, so yes, we are continuing to consider and work with airports to try to get to a position where we use testing, if not as a complete alternative to quarantine, then a partial alternative. Obviously, we've been working within a working group with the UK Government. They've already announced some intentions to introduce a different system from the 15th of December. A couple of issues we in the Scottish Government continue to think through, whether just before Christmas would be the right time to change substantially a position there, or whether it might make more sense to wait until after Christmas. But also there are some concerns. The arrangement that the UK Government have outlined is dependent on people paying for private COVID tests. We have some concerns about the accuracy and the reliability of private testing. That's not to say we rule that out, but we are continuing to take a very careful way through coming to a considered decision here. I know how important this is for airports, but it's also important that we get these decisions right so that we're not increasing the risk that travel is posing to our efforts to control the virus. Do you want to add anything on that?
I think that's testing done.
Yeah. Shona Duthie from Original 106.
Thank you, First Minister. What concessions, if any, did you have to make during the talks with other nations to ensure there was a consistent approach across the UK for Christmas? And secondly, you've just revealed quite a large rise in the number of cases in Grampian. Can you provide more details on what has led to that increase, what that might mean for a potential move down to a level in the next couple of weeks?
I wouldn't say I made any concessions. It wasn't really that kind of discussion. We all had the same starting point, which was, whether we liked it or not, we have to deal with a reality over Christmas, and therefore how could we make that reality as safe as possible? Around the detail, we will all have to set out some of the the points of detail where we may differ on in terms of definition of household, but we were all trying to come to a sensible outcome. And, as these things go, there were probably, fairly constructive discussions. But I will always try to reach decisions here that I judge are right for Scotland. And sometimes those decisions will make me unpopular. Sometimes maybe they will not. But these are all difficult decisions. And I just try to explain them and explain the uncertainties involved in them as clearly as I can. The last 8 months have been day after day after day after day of difficult decisions. This possibly is up there in some of the most difficult ones we've had to take because we know the risks involved, but we have to try and get these things right. And I'm conscious every day that, whatever we decide, some people will think it's right and some people will think it's wrong. If I had announced yesterday that we were allowing no flexibilities for Christmas at all, journalists rightly, the questions I would be getting faced with today are, why are you being a Grinch? Why is Scotland not being allowed the same flexibilities as people elsewhere? Why are you ruining Christmas? So, I can't take these decisions on the basis of what's popular and what's not. I've got to try and continue to take these decisions on the basis of what is, as Jason said a moment ago, not risk-free, because there is no such thing when we're facing a virus, but what is the most sensible course all along. On the issue about cases in Grampian, we've seen in the last, certainly the last week or slightly more, increases in cases in both Aberdeen City and Aberdeenshire. I've spoken about that in Parliament. That has meant that it's not been possible to take Aberdeen or the Shire down a level, but we've not yet considered it necessary to take them up a level, and that is largely because we have been able to attribute a lot of that growth in cases to specific outbreaks. So it hasn't necessarily been an indication that there is an underlying sort of background rise in cases, but we monitor that very carefully indeed, and I'll see the most up-to-date figures later today, but we have seen in the last couple of days, I think, just a slight moderation of that and a slight evening out of that. But that's the position in Grampian at the moment. But as with all areas, we pay very close attention on a daily basis to what these numbers are telling us. I don't know if you want to add more, Jason.
So I noticed the Grampian figures when they came in this morning. Gregor and I had a brief conversation about them. They are up today. They're up to 122 and the positivity rate is 6.5%. It's a single day, so it's important not to under or overreact to that. And Aberdeen City and Aberdeenshire do appear, as the First Minister says, over a 7-day period to have flattened. There are some food processing outbreaks that are being very well handled by the local public health community and the owners of those establishments, some extra testing in place in there, so that will inevitably just kick those numbers up. What we need to discuss with the Director of Public Health is community transmission versus outbreaks, and we will continue to do that. But yes, we are very, very vigilant about both of these local authorities, as we are with all the others, and the numbers have today just kicked up a little bit. If that stays up, we will talk to that Director of Public Health very carefully.
Thanks. Natasha Richardson from Bauer.
Thank you, First Minister. The SPFL has put out a statement calling for an emergency meeting with yourself about very quickly allowing football fans back into stadiums. A quote from Chief Executive Neil Doncaster says, if fans aren't allowed back into stadiums in limited numbers and carefully regulated, there will need to be an explanation of the clinical difference between English and Scottish fans. So what would be your response to this?
There is a difference right now between case levels in England and Scotland, and we're all trying to get case numbers down. And, there's no anybody, for the best of reasons, and I know that these comments always come from a good place of people that are very concerned about the impact in their sector. But, the idea that we are restricting anything right now for no good reason is just has no basis in reality. Of course, we do have a situation in Scotland where fans are allowed back into stadiums in limited numbers in level 1 areas, and we've seen, I think Ross County had fans back in a stadium, so we monitor that and we will continue to look at how we can safely increase numbers. But the emphasis has to be on everything we're talking about right now, how we strike the balance that keeps people the safest possible, and recognise that you can't, and this is one of the difficulties in all of this decision making, however much Neil Doncaster, for reasons I understand, is only looking at football, we can't see any sector or any part of society in isolation, because there's only so much we can do overall if we're to keep the virus under control. So, it's difficult for football, I know that, but it's difficult for lots of people, lots of businesses, lots of sectors right now. As I keep saying, we can see that light getting brighter on the horizon, but I'm afraid the next few months will still involve some tough decisions to try to get through the remainder of this pandemic with as little impact on life and health as we possibly can. But the one thing I can always defer to Jason on, one of the many things I can defer to Jason on the basis that he knows more about it than I do, is football. So I'll hand over to him to say a little bit more.
Mr Doncaster makes a good case for his sector. There isn't any doubt that Mr Doncaster speaks up for his role and what he does. And if I were in his seat, I would do the same thing. Unfortunately, it's not quite as simple as that. England had a route back to fans and then had 4 weeks of lockdown with no route back for fans. They've now announced again a new route back for fans from the end of that lockdown in some of their tiers, not everywhere. There is, let's say, a mixed opinion within public health circles. The chairman of the BMA said it was disappointing that there were going to be 4,000 people back in stadia potentially quite soon. We are cautious, but we have a route back for fans. The route back for fans is lower levels, and lower levels rely on prevalence in the community. Now, that doesn't mean that we don't engage in dialogue, and the Minister for Sport, officials, clinical leaders, me, others who work with me, are very happy to continue to engage with the football authorities and to get that back. But it's a risk-based choice. We understand the nature of the football business, and we need to both support that financially, but also support it to get that revenue back for them, but not at the expense of prevalence, hospital admission and death. And that's the same conversation we have with every sector, whether it's oil and gas or nightclubs or sport.
Fraser Knight from Global.
Thank you, First Minister. Under the plans for Christmas bubbling, you say entire households have to be involved in those bubbles. Now, we know that there are many people across the country who share flats or houses with people that they weren't particularly planning on spending Christmas with, perhaps, and they may be, getting pulled in separate directions from families to go home for Christmas there. Now, you've outlined plans for students to be tested before they all head home. I was just wondering, is this something that people who are perhaps living in flats and find themselves in that situation, could they perhaps be tested before they go home if they feel they are about to break the rules?
I have to be honest, I think it's unlikely that we're going to be able to do that in the period. We're focusing on students. The Health Secretary will set out in Parliament this afternoon some further plans to extend the reach of testing quite substantially, much of that before the Christmas period, not tied to Christmas in particular, but it will start before the Christmas period, so I can't stand here and offer that. Again, this will be an issue that we cover in the guidance we publish tomorrow. As you rightly say, students who have a term time address who will choose to go home for Christmas, they, because of the arrangements we're putting in place, will count as part of their home household over the Christmas period. But if you are living in a flat share, just generally for other reasons, we cannot simply have households splitting up to form other households, because the very careful limits that we have set would otherwise grow, and your 3 household limit would actually in reality become 4 or 5 households. So this will be harsh and hard for people, which is why, if you took a cursory, not that I'm suggesting anybody does, look at my inbox this morning, you will find people saying, yeah, this seems reasonable. You will find people saying, what are you thinking? You shouldn't be allowing any flexibility. And you'll find people saying, but this flexibility doesn't go far enough for my particular circumstances. There's no perfect way through this, but we have to be very careful about the definitions that we put around this. Otherwise, 3 households will grow and become much more, and that's where the risks that we're trying to minimise right now become much bigger. So I'm afraid when the guidance is published, I suspect we're going to get a lot of this, but what about this scenario? We're not going to be able to cater for everybody's individual personal circumstances. Every family has a different shape and size and composition, and we just have to try to put in place a framework that meets the generalities of that, but we can't cater for every single individual formulation. Tom Eden from PA.
Thank you, First Minister. Good afternoon to you both. Firstly, I just want to ask if there's been any modelling done for what the impact on the number of cases and deaths will be as a result of the Christmas relaxation. And secondly, Public Health Scotland figures released yesterday show there are now more than 100,000 people on waiting lists for one of, I think, 8 key diagnostic tests. What's being done to try and reduce waiting times for them, and can you see those waiting lists fall anytime soon?
I'll hand over to Jason on both these points to give a bit more detail. Obviously, getting waiting times for all procedures back down again is a key focus, and that depends on getting the virus under control, keeping it under control, getting out of this pandemic so that our health service can start to go back to normal, with the focus that we attach to catching up on things that had to be postponed earlier on. On the issue about modelling, I think you've got to be, so we look at all different possibilities, and we'll consider what we can do to try to give people a greater sense of why we are urging so much caution. But the danger is you can model based on the fact that everybody's going to take these flexibilities to the maximum. That's not what we're advising. We want to minimise this as much as possible. And so I will continue to say to people, if you don't need to, if you can, even if it feels horrible and you feel pretty grumpy about not having a normal Christmas, if you can just stay in your own home with your own household, please do that, because that's the safest thing to do. And that means that we are minimising overall risk when those who perhaps have to make a different decision are making that different decision. So our focus is on not accepting that there is just an inevitable impact in terms of the scale of that, but over the next few weeks trying to work our way through this so that we are minimising the risks that are posed. Jason, do you want to add anything on?
Yeah, so the modelers are very, very clever people, but they need 2 things. They need data, usually historical data, and they need assumptions. So they come to us and they say, what will happen next? What are you going to do on the 11th of December? And then they say, so these Christmas restrictions, what percentage of the population do you think will form 2 households, 3 households? Well, it gets really difficult really, really quickly. So modelling something as complex as whole population movement across 4 countries, when you're basically saying don't do it unless you have to, that gets quite tricky for the modellers, as does some of the data, because we haven't ever done that. We also don't know what we're going to do yet on the 11th of December, precisely. We don't know what the rates will be in each local authority. We don't know what England's going to do specifically with its tier system come the end of this week and beginning of next week. So the modellers are finding that quite tricky. We do know that if houses mix, risk goes up. If houses mix, we will almost certainly see a rise in prevalence. We want that to be as low as it possibly can, and we particularly want to protect those most at risk of the virus. And that was our first half dozen answers, as you heard us say. Now, there was a second question on waiting times. Yes, so the NHS and its remobilisation has happened. Now, that's no consolation if you've been sent a letter to say you've been cancelled or postponed and you're having to wait a bit longer. But we have managed in the second wave to keep much more of the health service open than in the first wave. Diagnostics, screening and procedures are now happening. The Louisa Jordan, although not seeing COVID patients, is doing both education and outpatient clinics. Some of my colleagues from the dental hospital have been doing outpatient clinics there over the last few weeks and seeing people for surgery over time. So we are doing our absolute best within the restrictions that COVID gives us, of course, to get through those waiting times and get to those people who have been waiting too long for them and for us. And we want that to continue. The best way of getting those waiting times down, I know it sounds like a broken record, is to reduce the prevalence of COVID.
Thanks. The Sun, Chris Musson.
Hi, First Minister. At noon today, the latest data was published on hospital-acquired infections. The Scottish Government will presumably have already had these figures under pre-release arrangements, but for those of us who haven't, they show another rise in people catching COVID in hospital, up to 200 probable or definite cases in the weekend in November the 1st. That's up from 189 the previous week. This means, as you know, that at the end of October, the weekly level was 80% now of the April peak of 250 cases, which must be causing you a degree of concern. Now, you've said that these briefings are about transparency and giving the public information about what's happening in the pandemic. So why didn't you announce these figures, given they're plainly a matter of grave public concern? And just to check on Christmas, following Tom's question then, is it the case that you're not going to tell us about the extra cases, deaths and hospitalisations that were forecast by the modelling about easing restrictions? Thanks.
I think Jason has just outlined why it's not as simple as doing that. On the first part of your question, on why I didn't announce it, these figures are published at 12 noon every Wednesday. They're there for people to see. I can go into a bit more detail than you have done. So we, in the most recent week, in a previous question you asked me about this, I've set out why these figures have more of a time lag than some of the other figures we publish, because it takes a bit more time for the experts to categorise whether an infection was definitely acquired in hospital, or whether it might have been, or whether it definitely wasn't acquired in a hospital. So in the most recent week, 3.1% of total infections were either definite hospital onset, probable hospital onset, or indeterminate, where it can't be clearly determined one way or the other. That is up from 2.3% last week. Now, you said surely this is a matter of concern. Chris, I can be very blunt with you that every single aspect of COVID, including this one, is a matter of concern to me. And people should be under no doubt about that. We've also set out previously why, not just with COVID, but with any infection, trying to limit spread within hospital is both a priority, but also what the difficulties of doing that in a way that gets it down to zero is, given the circumstances in hospitals. But we take a number of precautions. We support the front line of the NHS to take a number of precautions, and will continue to do that. And that runs from PPE through to testing groups of patients and also groups of clinical staff. And the Health Secretary will announce an extension of testing within hospital staff when she addresses Parliament this afternoon. So we take this extremely seriously. And one of the reasons we publish the figures is because we take it seriously and because we want there to be transparency around this. When we started publishing these figures, I don't know, forgive me if this is still the case, but I believe when we started publishing these figures, we were the first or perhaps the only government in the UK that did it in this detail at the time. So there is an absolute commitment to transparency here, but much more importantly, there's a commitment to supporting the front line of the NHS to limit spread within hospitals as much as possible. And that is a daily preoccupation of everybody who works within our hospitals, and particularly right now, everybody who works within a COVID setting. Do you want to say more about that?
Yeah, Chris, I agree with you. These numbers should be as low as they possibly can. 165,000 employees in the National Health Service, the biggest employer in the country, and every one of them wants to reduce the chance of transmission. The fact is that when you have high levels in the community, it is almost impossible to prevent some transmission inside institutions. We try as hard as we can with every resource. If people need more, they can have more. But education, PPE, this really nasty virus is what's causing these hospital and healthcare acquired infections, and we want them to be as low as we possibly can, and we continue to fight against it. But no country in the world, with the prevalence levels that you see in Scotland or across the UK just now, has got that hospital acquired infection number to zero. It's so difficult. We are really, really good at it. We have a lot of people who have learned inside the safety programme, in our attack on C. difficile and all these other elements. Our infection control guidance and leadership inside the hospitals is really good, but it's just so difficult to get it lower.
Alistair Grant from the Herald.
Can I just check, Professor Leitch, just following that? Last week, last week you said in relation to the hospital onset cases that it would appear that in wave 2, the numbers are much, much lower than they were in wave 1. Now, last week's figures weren't much below this week. So were you correct to say that they're much, much lower?
I think I said is what happens in wave 2 appears to follow the community transmission. I think that remains true unless I look and I've misunderstood it. In wave 1, actually the hospital-acquired the healthcare associated seemed to be higher because we didn't know enough about the virus then. We now know much more. We're more protective of the patients and the families, and the staff are better just because of the learning we've had. So I don't think that it's fair to say that people are not following as much as they can the guidance now, and that appears to follow the transmission rates inside the communities around those institutions.
Alistair Grant from the Herald.
Hi there, thanks very much. Minutes from a meeting of the Scottish Government's COVID-19 advisory group on November the 2nd warned that the pandemic could stretch till next autumn, and there needs to be engagement with the public on this. I think that meeting took place before the latest vaccine breakthroughs. But is that your position, that we need to be prepared for the pandemic and restrictions lasting into next autumn, even if that isn't the best case scenario? And can I just ask as well, just in the modelling, I know Professor Leitch was obviously saying that it's complicated, but have different scenarios been modelled? And if so, why can't you make that available for the public with those caveats?
On the first question, I have tried to engage with the public every single day during the pandemic, and I've tried not to sugarcoat any of this, and that at times has no doubt made me sound like the purveyor of doom and gloom, but I've tried to be straight with people. So I've never stood here and said it will be all over by X date, and then had to sort of change that when it turned out not to be the case. So, you know, I don't have a crystal ball. I cannot stand here and say, here's a date next year when this will all be over. It may be that we are living with the remnants and the tail of this pandemic for a period. I can't say that with any certainty, and nor can I rule that out with any certainty. What I do know is that the news on vaccines, which, as you rightly say, has transpired since the minutes of that meeting that you talked about, so we'll no doubt, if that had been known at the time, may have changed the views that were being expressed there. But since the good news on vaccine, I am much, much more optimistic than I've been at any stage in this, that by around the spring of next year, assuming all of the positive news on vaccines translates over the next few weeks into licenses and supply as we're predicting, then I am much more optimistic that by around the spring, we will be well on our way to a greater degree of normality, that we will be able to start enjoying the things in life that we all like to take for granted. Now, I can't, as I say, put a specific date on that. I can't say that by such and such a date it will be 70% or 80% or 90% normality, or maybe a bit lower than that. There are uncertainties in there, but I am absolutely much, much more cheered and optimistic and confident that that's the kind of medium-term horizon that we are now looking at because of all the positive news we've heard. But for as long as we're in this, we'll try to be frank with people about what the scenarios are, what we think might or might not happen, but also as part of that, be really frank about the inherent uncertainties that are in all of this. And right now, there's still a lot we don't know about the next few months, as well as much more that we can now confidently predict. So I feel, I stand here and I feel very anxious about the winter period. I feel anxious about Christmas, as everybody does. I think the winter is going to be tough, and all of us can act in a way to try to make it a bit less tough than it would otherwise be. But I'm not going to pretend that the next 2 or 3 months are not going to be difficult. But I feel much, much more confident now that the period after that may well be a lot easier, and that we, while we're talking about Christmas right now, by the time we get to talk about Easter, we may not have these same anxieties to the same extent about families coming together. So that's, just something for all of us to keep hold of at the moment. And on modelling, I'll hand back to Jason. There is no... What I'd ask people to remember here is that I think you hear from me right now that if you don't need to travel and see other people, I really would prefer you didn't do it. So I'm not trying to say to people, Christmas will be fine, on you go, enjoy yourselves. I hope people find ways of enjoying themselves. But what I'm saying is, please don't travel. Please don't meet up with other households if you can avoid it. So if there was some big scary model that I could put in front of people to try and make it more likely they'd follow that advice, I wouldn't be deliberately hiding it from you. But there's a lot of real uncertainties and imponderables around trying to do that. So what we're trying to do is just say to people, there is a risk. It's hard to quantify it because we all know the different assumptions that you would have to make, but there is a risk, which is why we're trying to persuade you to operate in a way that minimises that risk.
I think I've covered the modelling. We don't have very specific modelling that if this happens at Christmas, we'll get 100 infections, 1,000 infections or 10,000 infections. That is simply impossible to get. I know that if we mix households, we will get more infections. So therefore, if you don't have to do it, don't do it. To the first question, the only other element I would add is the World Health Organization will decide when this pandemic is over. Because even in New Zealand, where they have very, very low levels, they don't believe the pandemic is over. It is a global phenomenon, and we will have to solve it globally. Now, Scotland may see some more normality by the spring. That will not be the end of the global pandemic, and we will have to live with the outcomes for every country around travel, around freedoms, until we can get to a point where we live with this virus in an endemic way, rather than how we've had to live with it just now.
Thanks. Conor Matchett from the Scotsman.
Thank you, First Minister. Following on really from Tom, Alistair and Chris's question, the Scottish Greens have called for you to publish the risk assessments connected to the decision made yesterday. Can you confirm whether those risk assessments will be published to help people better understand the risks that you're so keen to urge them to take into account? And secondly, if I may, last week, the Scottish Government refused to release forecasting analysis on potential deaths from a second wave of COVID-19 that was done back in September due to it not being in the public interest. Can you explain why the Scottish Government believes it's not in the public's interest to know what the government understood the potential risk to human life to be for a potential second wave of COVID-19 that we are now living through?
On that latter part of your question, forgive me, Conor, I'm not entirely sure what you're talking about, but I'm happy to go and educate myself in exactly what you're talking about and come back to you with an answer. I hope, whatever people think about the decisions we've taken, I don't think, and yes, people will always have a natural desire for more information. And sometimes a lot of the information we get asked for right now, I understand why people are asking for it, but a lot of the time it's information that doesn't exist here in Scotland or anywhere else. People will say to me, publish the hard evidence that if you shut a pub, you'll reduce transmission. Well, that hard causative evidence doesn't exist because we draw and make assumptions from what we know about the virus, that people coming together in certain environments has a greater risk of the virus spreading. And that's a general knowledge that we then apply to particular settings. Likewise, again, I don't know, I haven't seen what the Greens are asking for, so I don't know what they specifically mean about risk assessments. Sometimes the best I can do is stand here and talk in general terms about the risks and what we need to do to minimise those risks. There's not some magic model or piece of analysis that's going to answer all of these questions for us. I have very often in the past 8 months wished that were different, but it's not the case. Common sense is our biggest ally in all of this. How does this virus spread? It spreads from one person to another, one household to another. And so how do we stop it spreading? We try to stop being together, and at times where that is difficult, like the festive period where it will be more difficult for more people, we try to put sensible precautions in place and sensible limits around that. And as we do all of this, we're upfront with people that every time two people come together for whatever reason and whatever circumstance, we are increasing the risk of the virus spreading. And I know there's a desire for us to make it more complicated than that, but actually at heart, it's not more complicated than that. So we try to keep people apart as much as possible, recognising that the human experience means that that's not always possible. So we have to put sensible advice in place for when people are coming together. And that's the reality. But on Christmas, and you'll hear me say this probably every day between now and the 23rd of December, just because recognising a reality, we're saying, look, these are the outer limits that we are saying are permissible. is not us saying we are encouraging you to do that. And that is a really important thing that I hope we can get across to people. Tom Martin from the Express.
Hi, good afternoon. Thank you, First Minister. Summer's relaxation of the rules saw people getting together for barbecues and picnics, being told to take their own cups, cutlery, food, plates, and so on. Should people who do take advantage and get together for Christmas dinner now do the same to help prevent the spread of the virus? And secondly, if I may, for the National Clinical Director, part of the curtailment around Halloween celebrations involved concerns around the passing of sweets. What advice do you have for people who will be out now Christmas shopping for gifts for relatives and friends? You know, what things should they be bearing in mind to, again, prevent the spread of risk?
Jason will no doubt answer that question in his own inimitable style and way, and I will brace myself before he does it. But there will be a limit there is a limit to the amount of advice we can give people. And I say that as a political government leader who stood here over the past almost a year now and given people the kind of advice I never imagined I would ever have to do. But even in that context, there is a limit, and trying to tell people what they can and can't buy loved ones for Christmas probably takes us over that. So what I'm about to say is not actually from a public health perspective. I'll leave that to Jason. What I'm about to say is actually from an economic perspective. You know, particularly now when we've got non-essential retail closed in large parts of the country, maybe this year you should think about buying, you know, a gift voucher for a loved one, so that in the new year, as we're trying to kickstart retail again, you give a boost to the economy. And although you're paying for that now, so you're helping right now, and you're allowing a loved one to get the benefit of that later in the year. So maybe think about shop local, online, albeit at the moment in some parts of the country, but shop local to help local businesses. So I would encourage people, not just from the public health perspective, but from the economic perspective, to think about how our Christmas shopping choices might actually help the high street and help retail and the economy more generally. And on taking your own cutlery and plates and such like, obviously we'll try to fill in as much detail as we can in the guidance we publish tomorrow. And you know, again, this is in the realms of, am I actually standing here saying this kind of stuff? But that's the reality we're living in just now. Yes, if you are seeing other people over that 5-day window for Christmas, then yes, think about things that you wouldn't normally think about. You know, think about maybe taking things yourself that you would normally just use in somebody else's house. Make sure you're cleaning things. Make sure, even although it's in the depth of December, you've got windows open so there's good ventilation. Don't forget to wash your hands. Just keep a bit of physical distance, which we know in people's own houses is more difficult. But even coming together in these very tight limits that we're setting, and remembering these are outer limits, it can't be a normal experience. It shouldn't be a normal experience if you're trying your hardest to protect those around you. Right, Jason, what is your Christmas shopping advice?
I think we're going to be doing this for weeks. So the virus spreads from person to person and from surface to surface. It likes shinier surfaces better than rough surfaces. It likes glass, plastic, worktops. It also quite likes shared utensils, you could imagine. But it doesn't like wrapping paper, cards, envelopes, post. It dies very quickly on rougher surfaces such as that. So you shouldn't worry about Christmas presents in any real deep way. But you should have hand sanitizer in the room where the Christmas gifts are, like you should have anyway. And lots of people have had birthday celebrations, often very restricted, often outdoors. I have with my family. So I would expect you to wash your hands before and after that activity, just like you would in other activities that you're doing in this period. I think if you're eating together, that's going to look a little bit different than last Christmas, and I hope from next Christmas. So I wouldn't have a big bowl of roast potatoes with one spoon in it that all 6, 7, 8 people share. So that should probably be served somewhere else and then served on the plate. That kind of minute guidance is not going to be written down by the government. We're not going to tell you exactly how you should serve your roast potatoes. But if you think about the spread of the virus, and remember, every single person who catches this virus gets surprised when they catch it. every single person. So it could be in the room. So you just have to think about the distancing, the surfaces, the stuff you're touching, but please don't worry about your Christmas presents.
Good. Turns out I didn't have to brace myself too much after all. Georgina Hayes from The Telegraph.
Good afternoon, First Minister. In England, they're going to relax some of the restrictions on hospitality by scrapping the 10 p.m. curfew for tiers 1 and 2. The Scottish hospitality industry have called for some greater parity with England and for the Scottish Government to allow businesses in levels 2 and 3 to stay open until 10 p.m. And they say that they're actually quite a safe way for people to socialise because they've been made COVID secure and they have test and trace. So now that there's a vaccine on the horizon and if cases continue to stabilise, can you say whether you might consider easing some of the hospitality restrictions in middle levels over the coming weeks?
Our hospitality restrictions in each level are set out already. We have no immediate plans to change them. I've said all along we will keep them under review. One of the things we look at just now is whether the totality of restrictions in each level is sufficient to do what we are expecting that level to do, and that's an ongoing assessment, but we don't have any immediate plans to change the contents of the levels. And while I know hospitality will want us to equalise with England, where that is liberalising things, and you know, again, I'm not criticising them, I totally get that. I'm sure they won't be as keen for us to do that in the other direction. So if you take England's new level 3, as I understand it, that will include the continued closure completely of hospitality, apart from takeaway. In our level 3, that's not the case. So, you know, it's easy just to say equalise in one direction, but we've got to look at this on the totality, and the restrictions set out in our levels are the ones that are in place right now, and we have no immediate plans to change them, although, as I say, we keep them under ongoing review. Rachel Watson from the Daily Mail.
Thank you, First Minister. As you've mentioned a couple of times, there's obvious concern that the relaxation of rules at Christmas could lead to a rise in cases. Can you explain a little bit about what will happen immediately after the relaxation of rules? Will areas remain in their same level or tier, or are you looking at ways to potentially tighten that up after Christmas? Or will there be a kind of immediate review after the festive relaxation?
Well, we'll have to keep all of this under review. If people are, as I believe most people will be, very responsible and sensible and make, kind of the informed judgments that I think most people will, hopefully the impact of this will be less. If everybody decides to, have travel all over the place and have 3 households, then obviously the impact might be greater and that may lead to certain decisions. But we keep that under review. I'm not going to say now what level different parts of the country will be in January, but we will continue to think about these things all along. And if there are things in advance we think we want to signal to people, we will do that. Certainly in a general sense, if you are planning over Christmas to see a loved one that you haven't seen, then we would say in the few days before that, be very careful about what you're doing to minimise your risk. And similarly, in the few days after that, you should probably be careful not, if you have inadvertently got COVID, that you're not then passing it on. That's one of the reasons why while I know some people will think, oh, that's not good, that's not fair, it's why we've not decided to do any relaxation over New Year, because if you have people, even in a limited way, coming together at Christmas and then a few days later again, then you are increasing the risk of a kind of onward transmission of the virus. So we need to, over these next few weeks, and we will try to communicate risk and how people can minimise risk as carefully as we can. And that's one of the many reasons we stand here every day or most days and go through all of these different points and all of these different questions. The last question today is from Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister. I want to look a little earlier than Christmas, if I may. Tomorrow is a pandemic version of Carers' Rights Day across the UK. In 2016, each of the 4 home nations enshrined in landmark laws the duty of local authorities proactively to ensure that unpaid carers have the right to their own needs assessment and support, separate from the person they care for. So in the 4 years or so since these acts came into being, and particularly during the pandemic, how effective do you believe the act has been in Scotland? Is it helping? Has it helped at grassroots? And in light of that, how does your government plan to mark tomorrow, Carers' Rights Day?
We will mark it in no doubt a range of different ways on social media and in other ways. I will take the opportunity right now to mark it a day early by just really from the bottom of my heart saying just a heartfelt thank you to unpaid carers the length and breadth of the country. Outside a pandemic, unpaid carers make a contribution to the country that is almost impossible to quantify because that contribution will be in financial terms because of the extent to which they are saving the NHS or local government services having to step in, but in an emotional sense as well, the contribution is really difficult to quantify. And I don't think there's anything we can ever say or do that properly compensates or recognises unpaid carers. But I hope everyone watching who's in that position knows how deeply that gratitude is felt. How effective is the Act? I think the Act has and will have made a difference to a lot of people. I equally don't think we should be complacent about that and think that it's job done. With any piece of legislation, passing it is the easy bit usually. It's then an ongoing process to make sure it's having the desired effect. And I think given the added pressure and burdens that unpaid carers will have experienced during the pandemic, as we come out of this pandemic, I think that will be an important opportunity to review things like that to see whether we need to do more. And of course, we will continue to try to take steps in other ways, not least through the carer supplement, for example, where we have support that's not available elsewhere in the UK, and we made an additional payment over the pandemic, try to recognise in a financial sense the massive contribution that carers make. So this will be something you hear us talk a lot more about in days, weeks, months, probably years to come. But for now, I hope every unpaid carer that is watching knows how deeply grateful we are to you for what you do. That concludes the questions we've got today. So thanks to everybody for watching. Thanks to the journalists, thanks to Yvonne for our BSL interpretation, and to Jason for helping me answer the questions. You'll hear us talk a lot about Christmas, obviously, in the days to come, but as we get to that point where in normal years families are starting to think about their arrangements, but that's got a particular resonance this year, I would just continue to urge you to be cautious and careful. As with so many things in this pandemic, just because something can be done doesn't necessarily mean that it should be done. We're trying to balance all sorts of difficult considerations and find the best possible pathway through this. And we're recognising a reality for Christmas, but that does not mean that we can or should stop advising you of the risks anytime different households are coming together. So please think carefully. If you can get through Christmas in your own home with your own household, that is the advice I would give to you. If you can't do that and you want to or feel you need to meet up, think about how you do that in the most limited way and in the safest way possible. So limit the numbers, limit the days you're doing it, and keep it outdoors if you can rather than indoors. And if you're indoors, make sure you're planning now for all of these sensible precautions that will help to minimise risk. This is not easy for anybody, and the next few weeks are probably going to be even harder than the 8 months that have gone before. But I just keep reminding people that we are now starting to see that glimmer, more than a glimmer of hope now, I think, on the horizon. So let's just, for this last period, hopefully, of the pandemic, make sure that we're not slipping up in our own personal interactions at the last moment and putting people we love at risk for the sake of seeing them at Christmas when we might be putting them at risk after Christmas. So we'll talk more about this tomorrow and in the days to come. But in the meantime, for all the talk is about Christmas, don't forget the here and now. The rules that are in place right now are what matter most, because they are what will help us drive these infection rates down, and that's the best thing all of us can do right now to keep ourselves and others safe. So my thanks, as always, for everything you're doing to help with that. Please, if you're watching, spread the message to those who can't watch these briefings when they happen. And tomorrow I will join you 12:20 from the Scottish Parliament, where I'll give an update, say a little bit more about Christmas guidance, and then we'll have the weekly session of First Minister's questions. The briefing here will be led in all likelihood on Friday by the Health Secretary, but that will be back here at 12:15. In the meantime, thanks very much.